Villa Derma Care Division. And this kind of a session, scientific session, this is a 36th digital webinar that we have been continuing in continuous medical education to the medical fraternity and the corporate professionals and the general public. And in this short note, I give the uh, session to Dr. Pratik.
Yeah,
I request Dr. Pratik to
thank you,
take care of
Lakshmi.
the session, and over to Dr. Pratik.
It's my pleasure on behalf of Cadila Dharma Care to welcome our today's speaker who is going to educate us about how to deal with dry skin. Since the winter is has already arrived and it is obviously the right time to get us all educated about what does dry skin mean and what are the other aspects which all the people should be aware. So it's my honor to welcome Dr. Deepa Kanchankoti. She's a consultant dermatologist from Mumbai, having a vast clinical experience of over 18 years. Has been awarded with Dr. P.B. Joshi Award for her academic excellence in dermatology for standing first at the University of Pune. Madam has attended various national and international seminars and workshops and has conducted many lectures and workshops for her colleagues in the medical field, students at various schools and colleges. Also, Madam has been former advisory dermatologist for the Clean and Clear Fresh Face Beauty Contest in 2015. She is also on the editorial board for TMT, Theme Tube, an online medical portal. And apart from that, Madam has been an active member of all the national and international dermatology association, be it IADVL, EADV, etc. So with this, I will welcome Dr. Deepa Madam to start the session.
Uh, Thank you, Pratik. I thank Cadila for giving me this opportunity to give information on the dry skin, and it is just the right season to do so. So, without wasting much of our time, let's start with that. Can I have my first slide, please? So, how to deal with dry skin? First disclaimer, there is no conflict of interest, and this is purely for educating the general population. What is normal skin? So when you look at skin, it just appears so non-specific, but then it is the largest organ of the body. And on an average, an adult has 20 square feet of it and it weighs about 3 kgs. The important parameter for healthy skin is that the skin pH should be acidic in the range of 4 to 6. So when you are checking your soaps, you should actually maintain the pH of soap in the range of 5.5 because most of the soaps are made up of pH, which is going to make the skin alkaline. Now, the next is the skin sebum, which is the oil or the surface lipid, that parameter, as well as what is the hydration level or the water content in the skin. So these are the three most important things where if they are correct, then you know that you have a healthy skin. So let's go to the next one. How do you see a dry skin or how do you diagnose a dry skin? So when you touch, the tactile will say that it is rough and uneven. In sensory, you will feel that it is dry, it is uncomfortable, there is itching, there is stinging, it is painful, and sometimes it just tingles. When you look at it, what do you see? There may be, if it is extreme dryness, then there may be redness, flakiness in appearance. You can see some scales, especially if you look at the legs, you will see those white scales coming out. There may be lackluster, it feels very dry. There may be cracks. So if you look at the skin on the outer side of the legs, you will find that fish scale appearance. And if it is an excess quantity, then it is called as ichthyosis, literally meaning fish scales. And sometimes dry white patches. In fact, if you just make a line drawing across your hand on the palms or on the on the hands, on the legs, then you will see a white line coming up. So you know that your skin is dry. Functionally also there is an impairment, that is there is an increase in the water permeability. The water goes evaporates high, that is called as high transepidermal water loss. I will be talking about it in detail a little later. And it is less resistant to absorption of noxious substances. So what if there is dry skin? If you are thinking that way, then that is incorrect, because dry skin allows penetration of so many harmful substances in the skin very easily. Chemically, if you look at the dry skin, then there is reduced water content, and there is something called as NMF, natural moisturizing factor, that is also reduced, and the composition of the lipid or the fat inside the skin is changed. Next slide. So what are dry skin diseases? So earlier we saw how a normal dry skin would look like or what will be the changes. But there are extreme dryness, and when that happens, uh, you know that there may be a disease condition associated with that. Some of the diseases are like atopic dermatitis, ichthyosis, irritant contact dermatitis, psoriasis, steatotic dermatitis, or eczemas. Let me just explain you. Atopic dermatitis means the skin is very sensitive. Some people are born with that. Some people manifest it at a later age. Some people manifest it at much later age, where the entire skin becomes very sensitive, red, stingy, and itchy all the time. And if they try to apply anything on their skin, it starts getting irritated because they can't tolerate it. Ichthyosis is a condition which is the person is born with, where there is inability to hold the water in the skin, and depending upon the grade of ichthyosis, the severity of the dryness can vary, and these people have to perennially throughout the year have to keep using moisturizer because they don't have genetically ability to hold the water. Then irritant contact dermatitis, that is you or allergic contact dermatitis, you come in contact with a substance, suddenly you become allergic to that, or the skin gets irritated by that and the skin starts breaking, and there may be the cuts which will develop, and it will become difficult to function with hands if that happens. Mostly it happens in hands and feet. Psoriasis, as you all know, is a genetic condition, and it has patches where the skin becomes very thick, scaly, and then sometimes it can go so severe that if the person is removing the shirt, the scales can fall on the ground. Sometimes it's there on the scalp, sometimes it's there affecting the palms and soles. So in all these areas, there are thick scales which the patient gets irritated by. In fact, patient comes to us asking for quick remedy, because every time they want to shake hands with anyone and they have cracks or dry skin in the hand, they find it quite embarrassing, and it is a psychological trauma for them. Steatotic dermatitis is experienced by most of us during winters, wherein the skin becomes extremely dry in certain areas like the legs and the back. This is also commonly seen in elderly people. And various types of eczemas can manifest as extreme dryness. Next. So before we understand what the moisturizer is, let us understand what a normal skin is. So if you have to look at the structure of a normal skin, then it is like a brick and mortar model. That is, all the cells of the skin are like the bricks, and these bricks are layered one on top of each other, and each of these cells are connected together by a cementing substance. So the tighter those cementing substances are there, the water that is going from within outside upwards, that is the water loss that is happening, is less. Sometimes there is a defect in these cementing substance. When there is an extreme dryness, the cells, they shrivel, they become small in size, and then the water loss can happen. So if you see that in between the cells, the water can just pass through. So that is intercellular gaps, and then the water is evaporating. Not only the water is evaporating, also the foreign body or the noxious substance can enter into the skin through those pathways. Then there is something called as intracellular, wherein you can pass through and through the cells and then can enter. The same way the water can evaporate. And of course, you can always find other ways wherein you can inject. If there are deeper cracks, then it goes directly into the skin. So once we have this brick and mortar picture very clear, you have to understand that we have to stop the evaporation of the water for the skin to hold the water and make it more soft and supple. Next. So what are the different types of moisturizers? The moisturizers are technically or of three types: the humectants, emollients, and occlusors. Humectants are the moisture absorbers. They draw the water into the top layer of the skin. That is from the atmosphere, from the different cells, they draw the water. This is also called as the hygroscopic action. You must have seen that if you sprinkle salt on the table, after some time you will see some water droplets over there. Why? Because it takes the moisture from the air and then becomes a water droplet. The same way humectant also helps in drawing the water from the air. So examples are urea, glycerin, hyaluronic acid, propylene glycol. The list is very big, but I've just chosen the more commonly used ones. Then the next one is emollient, which is the space filler. So I just showed you the different spaces between the cells of the skin. Then they fill these cracks and seal the water in. Example is shea butter, cocoa butter, dimethicone, lanolin. And then there is this occlusives. Now, these are moisture sealers. The water has gone in, you have blocked it. Now the water can't evaporate. So they act as a layer or a barrier which prevents the evaporation of water from down to up. So the examples are mineral oil, petrolatum, and beeswax. But if you actually look at any particular moisturizer which is commercially available, then it is not just one type. Usually it is a combination of all of them. Depending upon which one is more, we have to choose as heavy and light moisturizer. If I have to show pictorially, then here it is how they work. The first one is occlusive agent. What it is doing, it is forming a layer on top and preventing the water loss happening. The other one is humectant. What it is doing, it is withdrawing the water moisture from the air and other areas. And emollients will act as again a layer which will fill in all the gaps. Okay, so these are the way. Now you have understood what is the skin structure, you have understood what the moisturizers are made up of, but which moisturizer is right for you? How do you check for that? So that is checked by, you have to first decide you are buying a moisturizer for which body part. Is it for the face? Is it for the body? Is it for hands and feet? Or you have cracked soles? Because a face moisturizer will be lighter because the structure of the skin over is slightly different from the entire body. If you're looking for hands and feet, then there is a different moisturizer because these agents will require a thicker cream which will help moisturize this thicker area of palms and soles. And if you have cracked soles, then there is accumulation of excessive cells over there which needs to be removed and also the gaps to be filled. So you will be surprised to find that there is a different moisturizer for different body part. Then moisturizing as per your body type. Maybe the same moisturizer will work for the whole family if all of you are having a similar type of skin, but it may be different based upon somebody is having oily skin, somebody is having a dry skin, somebody is having a normal skin. So whenever you are looking for a moisturizer, look, the label does read it because everybody can't read which content will work for which type of skin. But you definitely know that your skin is dry or your skin is normal. So you know that, okay, moisturizer for normal skin, moisturizer for dry skin. You have to read that and then pick and choose your product. Also, which season you are buying the moisturizer. If you're buying in winter, then you will require a heavier moisturizer because the atmosphere itself is causing the skin to be robbing away the moisture from there, and there is excessive dryness, that what we call it as the dry skin of winter, and you will require a heavier moisturizer. The same moisturizer you try to pick and choose during summer season, you will not like it. You'll find it sticky because you're sweating all the time. At the same time, you're having a heavy moisturizer. You yourself will not feel comfortable. So use see which weather you are buying. Then which part of the country you are located. If you're located in places like Mumbai or any coastal area, then the weather here is very humid. People always feel very sweaty and the dryness is not so much. And if you go to northern India, or when patients, they are coming to us and they are asking, I'm going out of country, can you suggest some cream that I can use? And my first question is, which country are you going? Not because I want to know where they are going, but I want to know which location they are going. If they are going to southern the close to the equator, then I know that they will require a light moisturizer. But if they are going to somewhere which is like up north Europe or up north Canada or US, then I know they will require a heavy moisturizer because a light moisturizer will not help Coming to the next one, which is which part of the day you are planning to use the moisturizer, because night moisturizers are usually heavier and the day moisturizers are light. And I will be elaborating more upon in the later in the lecture. Then, for which family member you are buying the moisturizer? We know that all the baby products, they come with the label that for babies, but then we don't get moisturizers for elderly, for teenagers. That kind of label doesn't come up. But yes, there is a difference. So for babies, there is a different range of product. For teenagers, because they have a very oily skin, if they are filled up with acne, the same moisturizer which you're using for the elderly in the family will not work for them. So the person for whom you are buying is also equally important. And of course, what matters is the cost of moisturizer. Now, cost of moisturizer is so important is because if you're just using it for your own self and you have a normal skin and you are buying a product which is expensive, then it works fine. But when you're buying it for the whole family and you're applying it all over the body, then cost definitely matters. Also, some moisturizers are cheap and some moisturizers are very expensive. Very expensive. You can have, I don't want to take the brand names, but then you can have a small bottle which can be for 10, 11 rupees. And you can have a moisturizer worth 28,000 also, such a small bottle. Why there is so much of a difference? The difference is because the ingredients, how each one is acting. So we have to decide where is our limit, which is the right one, because if you use the wrong one, then there will be a problem. And I will explain you about the cost at a when I will discuss about one of my cases as to what how the cost mattered to him. Next. So why do we need a moisturizer? At what age the skincare regime should begin? This is a question which is asked by many. Like, I get parents who bring their teenagers and they say that I think my child should start taking care of the skin. That doesn't happen too often, but it does happen. People are getting aware about, healthy skin regime. And frankly speaking, all age groups require moisturizers. Newborns, babies, we definitely apply moisturizer. We give them oil bath, then we apply moisturizers. Post that, we buy a separate kit for them. But as these kids start growing older and older, people forget about applying moisturizer. But kids also require it. Teenagers, when they break out, they will just come up and say that I need only acne treatment. I don't need a moisturizer. And then adults, they are too busy taking care of the career and the home and juggling with n number of things. And elderly, they are all the time scratching or end up applying some oil and still complaining that I keep applying oil all the time, yet I feel itchy and scratchy. Because uh, by applying oil, all they are doing is applying an occlusive agent. They are not utilizing the advantage of humectants and emollients which a moisturizer can provide. So uh, you can use oil as a pre-bath moisturizer and then have a bath and then apply the moisturizer. Skin repair happens in a well moisturized skin. So if there is any damage, it will be recovered if you moisturize it well. Otherwise, it will keep cracking. And to give you an example, you must have seen when it doesn't rain, the surface of the soil, it cracks. And if it doesn't rain for many, many months, then the cracks go much deeper. The same happens with the skin because the water keeps evaporating and there's nothing to replenish it. And the moment it rains, everything, all the cracks, they fill up. Same thing applies to that. So you have to understand that moisturizing is very important for repairing any kind of skin damage. Coming to reducing the fine lines, smoothening and hydrating the skin. This is there for the face where you want a flawless look, when you want the plump, glowing skin, then moisturizing is important. Also, those who apply makeup, they don't know when to apply the moisturizer. So as soon as you wash your face, you first apply the moisturizer as the base and then you can apply makeup on top of it. The moisturizing effect maintains a good makeup uniformity as well as it doesn't dry up, because makeup does cause dryness in the skin. And once you remove the makeup, then again you have to apply the moisturizer. It also acts as a base for the treatment of acne and pigmentation. So all the acne and pigmentation, the pimples that we treat, there is a peeling agent. These peeling agent act and correct the proper disease process that is happening. But if the skin is irritated and you are applying a peeling agent, it will irritate furthermore. So if you hydrate the skin and make the skin normal and then apply these treatment creams, the effect is far more better. But then people come up and tell me that I have an oily skin, I don't need a moisturizer, I just need the treatment for acne. No, it's not that you have an oily skin. I understand there is an oily skin. That is why you have an excess oil production. But by applying a moisturizer, you are increasing the water content in the skin. And we all know oil and water are different. So even if your oil content is more, you can still use a moisturizer, and a well hydrated, well moisturized skin, the acne treatment gives faster and better results. In fact, many of the cases where the pigmentation is more, something like PDL, pigmented demarcation line, where there are hardly any treatment, if you keep the skin well hydrated, then the pigmentation goes away slowly. Then moisturizer act as a base for applying anti-aging cream. The most of these good anti-aging creams will have a product which is retinol based. Again, retinol is a peeling agent. So if you apply that directly to the skin on a daily basis, your skin will peel, and then it will become extremely dry and you will not feel comfortable applying these anti-aging creams. So it's always a good thing to apply the moisturizer first, wait for 5 minutes, and then apply the anti-aging creams. Now, next slide, please. So when should I apply the moisturizer? As I said, immediately after bathing, within 3 minutes if you apply, then what happens? The water has seeped into the skin. Now you wipe your skin and now you apply the moisturizer. It holds the water that has gone inside, and therefore the need to reapply the skin again and again becomes less. Then immediately after hand washing, these days we are getting a lot of patients who are having hand allergies, and they come up with red cracked skin and white skin, and these areas which are very irritated. That is because they are repeatedly using a hand wash, drying it, and then again they are doing it, but they are not replenishing the natural moisturizing factors which have been removed from the skin. Also, women are washing utensils, they are washing clothes, they're cleaning the house, they're doing everything with where the hand is in water constantly. They wipe it, but then they don't replenish that. So there is use of soaps and detergents, which acts again as a agent which will remove the natural lipids of the skin. So very important, whether you are washing your hands for hygiene purpose, or for cleaning something in the house, or for just sanitization, or in fact even after the hand sanitization, you should apply the moisturizer. Then coming to aftershave. So many people have this area, beard area, getting a lot of irritation because they are doing it, but after that they take bath and just go to office, but then they don't apply the moisturizing. So aftershave, women anyways apply, but men generally don't apply so much of moisturizer, so they too have the need to apply moisturizer. Every time you wash your face, you must apply a moisturizer. And then repeated use in dry skin conditions. When I say repeated use, it means depending upon the dryness. So atopic dermatitis, psoriasis, ichthyosis, eczema, all the conditions that I mentioned before, they have very dry skin. And if you depend too much on the medicines, then medicines will have problems. And if you want to cut down on the medicine dosages, either application or oral intake, the more you moisturize, the less will be the need of the medicines. Here, I would like to give an example of my patient. He had a full body psoriasis, and he got good results, but he still had patches all over. And he said that how to deal with this. So I gave him a very good quality moisturizer, and he was very happy. He said, I never had such clearance. I am very thankful that it got cleared. But doctor, I have a problem that the cream that you have given is very expensive. I can't afford it. For full body, if I have to apply this much, it's getting over in 5 days. My budget is getting disturbed. So can you please write something which is a bit cheaper? I said, okay, fine. Now that you are better, we can go back to that. So I wrote something which was not that expensive. After 3 days, he came back and he said, Madam, this doesn't work. And I was like, I knew that this doesn't work. That is the reason why I gave you the one which was slightly more expensive in the first place. He said, ma'am, please tell me something else. So I gave him a method, what we call it as wet trap therapy. Wet trap therapy means what? That I told him, you stand underneath the shower, soak your whole body for 3 to 5 minutes, and allow the water to get absorbed into the skin. And then wipe the whole body. And after wiping the whole body, what you do is you apply the moisturizer immediately on top of it. And he did that. And then he came back again after 3 days. He said, this is wonderful. Why you didn't tell this to me earlier? I said, because your problem is going to be lifelong. And if I tell you this method in the first place, you will be like, itni jhanjat kaun karega? Humko dusra kuch kaam nahi hai kya? But then the fact is, good moisturizers are there in the market. If you don't want to have so much of hassles, the concentration of the material that is used in an expensive moisturizer will be different, wherein their need for using repeatedly will be less. If you use a cheaper one, it will be more of an occlusive one. It will not have humectant or emollient action. And so it will not give you that kind of effect, the one the previous one was there. But if you really want to have a long lasting effect, like you, first thing in the morning after bath is you apply the moisturizer. Within 3 minutes, you have locked in the water. Whole 8 to 10 hours that you are in office, you are free of that. And then you come back home, take a shower again apply the moisturizer. So if you do that, your skin will be always soft and supple. Next. What else do you look for in a moisturizer? As I said, you have to first decide what is your skin type, dry, oily, normal, or combination. Accordingly, you choose because it's given on the label. See what the texture of the moisturizer, whether it is cosmetically acceptable. Sometimes it is too greasy, sometimes it is too oily, and sometimes it is so light that the patient will say, Doctor, what have you given? It just doesn't hydrate my skin. Give me something more heavy. So you have to judge for yourself. Maybe once you have tried this one, next time you can try the other one. Check its smell. Fragrance-free moisturizers are very important because fragrances can cause a lot of irritation. So there should be no smell. Then if you're looking for a day cream, then in the same, if you have a sunscreen, it will be an add-on benefit because you don't have to use now 2 creams. And they are much lighter and they can be applied before the makeup. So you have a moisturizer, a sunscreen, and then on top of that, a makeup. That's wonderful. Then you have the night cream. Then it will repair the skin, but they are very heavy. And check if they have additional retinol or any other anti-aging product. Again, that's an additional benefit. Always read the instructions and do look for words like hypoallergenic, non-sensitizing, non-comedogenic. What does it mean? Hypoallergenic means the chances of getting allergy with this type of moisturizer is less. Non-sensitizing means you will not develop allergy to something else. And non-comedogenic means it will not cause pimples to come. So non-comedogenic moisturizers are well suited for people who are having a lot of acne on the face. Next. So moisturizers are available in different formulations. So some are lotions, some are creams, some are ointments, some are gel. Now which one to pick up? You know, you have picked up the rest of the things, but what about these formulations? So if you look at the lotion, they are non-greasy and they are thin in texture. So they cover a larger area. So if you have to use something like during the daytime, or if you have to use on a larger body surface area, or you are very hairy and there's a lot of hair, then in the beard area, then you should use a lotion. If you're looking for something which is aesthetically more appealing, then you go for creams because they are made up of slightly heavier lipids. You can use it on the face at night time. You can use it on the hands. You can keep it in your bag so that whenever you want, you can just remove it. You've sanitized your hands, then you wait for some time for the sanitizer to work. And after some few minutes, then again, you can apply the moisturizer. But you cannot use this on hairy areas on this thing. So you have to apply on the non-hairy areas, and it is good during summers, not during winters, because winters will require a heavier moisturizer. So which one is heavy? Ointments. So there is a label which states whether it is a lotion, whether it is a cream, and whether it is an ointment. Because for many people, ointment and cream is same, but no. Ointments are greasy, they give a glossy look, they form a protective layer on the skin, and especially they are beneficial when the humidity is low, because when the humidity is high, you require either a lotion or a cream. They give an occlusive effect if required, and they should not be applied in intertriginous areas. What is intertriginous areas? The body folds and other moisture bearing areas, and they are good during the winter season. Coming to the gels have a smooth finish, and they are non-oily, non-comedogenic, and they get easily absorbed. So gels are best used for acne prone skin. They are useful in the body folds, they are quickly absorbed, they do not cause pimples, and they are highly acceptable on the face. Next. So dosage and method of application. As I said, the skin should be immediately within 3 minutes moistened after bath. Then you have to apply along the direction of the hair. So for females who wax, it doesn't matter. For small kids, it doesn't matter. They just keep rubbing and applying. That's fine. But for males or people who are very hairy, then you have to apply along the direction of the hair. If you apply like this, there will be rubbing of the hair root, and that can cause folliculitis. So you should be aware of that. Then you have to repeat the application depending upon the severity. And wet wrap therapy, I told you. So I have given you a picture of Kabuli chana. What is this Kabuli chana? Kabuli chana is absorbing the water into the pod, and it swells when you keep it overnight. Same way, when you have taken bath, the cells of the skin, they swell, and then you can apply an occlusive agent, and then the lasting effect is there. Dot method of application is you just apply dots and then spread it lightly. Next. So what are the simple changes in daily routine do you bring? That instead of a very hot water, jisko bolte kadak bath, kadak pani, use a warm water. Limit your time in the shower to 5 to 10 minutes. Wash with a gentle fragrance free cleanser. Apply moisturizer immediately after hand washing or bathing. Use ointment, cream, lotion, gel, depending upon the requirement. And coming to the lips is very important. When people get lip cracking, they keep licking the lip all the time. Lip licking will increase the problem. Instead, you use a lip balm, and these days we are getting lip balms which have got a sunscreen available in it. Then wear gloves. So you know that the detergent will rob away the natural moisturizing factor of the skin. So when you wear the gloves, the irritation goes down and the hands remain much cleaner. Next. So common natural agents that people use are shea butter, coconut oil, almond oil, olive oil, mustard oil, petrolatum jelly. Commonly, they just buy and apply it. It's good. It's good in certain conditions, or it's good in some places for some people, but it may not be sufficient for everyone, because they are not all of them having humectant, emollient, and occlusive properties. They have one property. So choose a moisturizer. Next. So what can go wrong with a moisturizer? A lot. Instead of soothing, the moisturizer can actually irritate and burn the skin. And why does this happen? Because of fragrances, synthetic dyes, and parabens, which are the preservatives. General moisturizers, if you're applying on the face, that the same cream for the whole family, then it can actually flare the acne. So acne prone skin will require lighter moisturizer. Then moisturizers can cause allergy. You apply it and you start feeling stinging and burning sensation. So that could happen because of ingredients like propylene glycol. So whenever that happens, contact your nearest dermatologist and get it diagnosed and treated. Next. So in conclusion, moisturization is the simplest and the key step in maintaining a healthy skin during all seasons, during day and night, and during all stages of life. Thank you very much.
Yeah, thank you so much for educating all of us, madam, regarding moisturizer. It was, I would say, all the A to Z about moisturizer, what every person should know. Or only 2-3 questions have come. One have few have been covered already. One is regarding.
Can you be a little louder, Dr. Pratik?
Yes, madam. Am I audible?
Yeah, I can hear you,
Yeah.
but just a little louder.
Yeah. So there are 3-4 questions have come, madam. One is costlier moisturizer is always a good moisturizer?
No, not always a costlier moisturizer, but if your moisturizer is not giving you the kind of result that you're looking for, you need to understand that you require a change. Not that every time every person requires a costly moisturizer. That's not the way it is. It's the other way around.
And one more question regarding the current situation, wherein how to prevent dryness with excess use of hand sanitizers.
Okay, so hand sanitizer basically contains alcohol, and alcohol is a drying agent. And when you apply that, it removes all the lipids from the skin. I won't say all, but on from the surface. And when that happens, and it also contains certain preservatives and other agents, so that is going to happen. So it is important that before you develop a dryness, you make sure that when you are carrying a bottle of sanitizer, you do carry a bottle of moisturizer simultaneously, and then you do that. In my clinic, I have to sanitize my hands 50 times at least, and I use gloves, and then I touch everything, and I am sanitizing on top of the gloves. When I go home, I remove the gloves, I wash my hands, and then I apply my sanitizer. So you also can follow the same principle, that whenever you wash or sanitize, after some time, allow that thing to act. Because if you just sanitize and immediately apply moisturizer, you are not giving enough time for that sanitizer to work. So wait for some time and then apply. But after washing hands, you can immediately apply moisturizer.
Okay, madam. And there is one more question which has come from Dr. Namrata. If moles or skin tag appear at various parts of body, red or black in color, is there any serious indication?
Skin tag.
Yeah, moles or skin tag appear at different parts of the body, whether red or black in color.
Okay.
Is it
So
something to be worried
moles,
about?
yeah, it is a slightly different topic. Moles are different. They are natural and they come as the age increases, and they have to be removed either with the radiocautery machine or by lasers, but they are harmless. But there some moles may not be harmless. You have to get them diagnosed that they are harmless moles. And skin tags, if they are appearing in the neck region, in the underarms, in the thigh area, then probably you have acanthosis nigricans or metabolic syndrome. So this can be removed. There is no natural way. Do not try stunts. The home remedies, they can prove very costly, and we do end up seeing patients who have done all these home remedies. They are very simple ways to remove them in the clinic. Just visit any nearest clinic and get them removed from a dermatologist, and also correct your acanthosis nigricans or metabolic syndrome that is along with it, which is indicated by black neck and the black underarms.
Okay, thank you, madam. And one last question from Dr. VK Chawla. Glycerin and equal amount of water. How does it work?
What?
Glycerin and equal amount of water. How does it help or how does it work?
So as I said, if you look at the natural substances which people use at home, glycerin per se is never active. It has to be activated by aqua, that is the water. So you can activate and use it. If it's working well for you, then you may continue using it, but it is only a humectant. It does not have emollient properties, and it does not have occlusive properties. So maybe your skin is normal and this much moisturizing is more than enough for you, but it may not be enough for everybody. So when you look at any moisturizer, most of them will have glycerin as one of the contents because it's a good moisturizer. But for someone else, you may require other than glycerin, other ingredients which will work 360 degrees for good moisturizing.
Okay. Thank you, madam. And just recently, one question came regarding cracks. How to manage cracks and dry skin of the feet? Please suggest the moisturizer.
Fine. So uh, there are cracks in the feet, that means the water loss is too much. And why the water loss is too much is because there has not been enough care taken when the cracks were small. So first thing is, when the cracks are small, you must notice them and start working on them right from that time. Also, we take care of our face because it's visible to everyone and it's very pleasant to look at, and nobody looks at our feet, so we also neglect our feet. So every day before sleeping, if not after bath immediately, you must thank your feet and apply a moisturizer every night, irrespective of which gender you are, which age you are. That is a preventive measure. As far as the if there is no disease condition, because there are plantar psoriasis and other conditions which can cause cracks. So if there is no disease condition and there is simple cracks, what I would suggest is that apply a moisturizer, and then you can put an occlusive. That is, sometimes we use certain medicines. I will not name the medicines right now because we don't know the diagnosis. It will not be appropriate. What we call it as giving the occlusive therapy. That is, suppose this is the heel of your leg, and you have applied the moisturizer, or then you take a plastic paper and you just put it across like this, and then take a purana dupatta or any cloth and tie it, keep it overnight. The natural heat of the body and the natural sweat of the body will make the skin a little soggy and allow the medicine to go deeper into the skin and will give a better result. And throughout the day, you can repeatedly use the moisturizer and wear socks. This will start healing it much faster. But diagnosing that these cracks are normal and not a disease condition is equally important. I think somebody asked a question about pH of the soap.
Yes,
Which pH? So 5.5 pH is something that we are looking at when it comes to soap. And you will find that there are Syndet bars available in the market with written as pH 5.1. Those are more appropriate, but everything comes with a cost. So you have to choose as per the requirement. Some of them are liquid soaps, some of them are solid bars. You can choose according to the requirement. As far as drinking sufficient water is concerned, then drinking water will hydrate the body. It is going into the blood circulation, it is going through the kidneys, it is going to all the cells, but it will not prevent transepidermal water loss, TEWL. In capital it is written TEWL. That is, epidermis is the uppermost layer of the skin. So transepidermal water loss, this water loss cannot be prevented by drinking water. You have to have something to hold in there. So drink lot of water, this will hydrate everything, but preventing that hydration loss will require a moisturizer. So both are equally important.
Okay, thank you so much, madam. I think all the questions have been covered. I will now hand over to Lakshmi
Yeah.
Narayan for what.
Yeah.
Thank you, everyone.
Doctor, you have been wonderful in explaining dry skin and management with the different tropical zones and age groups, different moisturizers and its application and its demarcation. It's a wonderful session today. I thank you, Dr. Deepa ma'am, and despite your busy schedule and accepted our request for today's webinar and to address the gathering, all medical veterinary, inclusive of corporate professionals today.
Thank you, sir.
All enlightened with your knowledge.
Hi, I have a question. Is it possible to ask? This is Pooja Asoka from Corporate Communications. Hello, good evening, doctor. Thank you very much for the very insightful session. I had a question. If one is suffering from urticaria, it's a common problem, idiomatic. I don't know what the reason is, but one suffers from urticaria, and it also shows on the face with dark pigmentation below eyes. So under eye creams do not work for that. So is there anything particular that should be done for that? Because by investing in under eye creams is a waste of money. It's not really sorting that. It's actually pigmentation caused because of urticaria.
No, actually, can you still hear me?
Yes, I can.
Yes,
I can.
Yeah. So actually, when you look at the under eye, the skin is very thin. There are blood vessels going. And the reason for under eye darkness can be a number of things.
Yes.
So when you use a under eye pigment removal cream, it only acts in reducing the pigment production. But if there is a rubbing, and that rubbing can be as simple as just this much. You need not be rubbing all the time. It can be just simply this much, or just doing this much is also called as rubbing. So that simple rubbing can cause thickness of the skin over that. And if you are going to use a cream which is going to stop the melanin production, it's not going to work. So you have to first see whether there is a rubbing action. Is there any atopy? Atopic dermatitis underneath the eye is very, very common. Allergic reactions are very common. Sometimes there is an eye strain and lack of sleep and lack of nutrition that we keep it aside, assuming that all of them are correct. But there can be blood vessels underneath that area due to Tyndall effect that will look darker. And also there may be what we call it as suppose the person is wearing nail polish, then the nail polish is the one which is causing that darkness. Or if there is acanthosis nigricans, then that can cause darkness. So there is that under eye dark circle itself is a huge topic. So if you're just going to use one cream, and if it is not working, probably you are looking in the wrong direction for the cause. So we need to find out the cause, and if it's hereditary, it is anyway not going to go.
Okay. Also, sinus problems, chronic allergies also cause darkness below.
Yeah, so that is called as atopy. That is called as atopy.
All right. Okay. So until one knows the cause of the allergy and can get rid of that, it's not going to go with cosmetic.
Yes.
All right. Thank you so much. Thank you, doctor.
Thank you.
Thank you once again, doctor. Thanks for your presence today, and prepared and explained clearly, clearly. People have understood what really dry skin in raw. Today, I thank you, my Vice President, Mr. Amit Ajmera, and Mr. O.P. Singh is our President, for allowing this kind of a webinar to conduct in digital webinar. I thank you, Dr. Pratik, Mr. Deepak, and Mr. Nirmalya for the successful conducting this webinar program. I thank you, Mr. Fazdar, FO from Mumbai. Thank you once again, and thank you all for participants. Thank you very much. Thank you very much.
Thank you. Bye.
We'll be connecting you, doctor, once again.